Welcome to this presentation on the ViOptix tissue oximetry monitor, which is a part of a series of videos on free flaps for OR staff. In this presentation, we will provide a brief overview of the setup and use of the ViOptix tissue oximetry monitor. In previous videos, we have talked about the importance of blood flow in free flaps. We now have technologies that allow us to assess end organ function, perfusion, or blood flow and oxygenation of the flap. ViOptix tissue oximetry monitor is a non-invasive method of free flap monitoring that uses near-infrared spectroscopy to assess overall flap perfusion. This technology provides continuous real-time monitoring, which can be monitored remotely by the surgeon on their mobile device. This technology is very sensitive, but can provide some of the earliest clues to impaired flap perfusion. Ultimately, this can allow a better chance at early intervention to avoid free flap complications or loss. The ViOptix sensor probe affixed to the flap emits near-infrared laser light that penetrates 10 to 20 millimeters deep. Some of this light is absorbed by the hemoglobin in the blood, and some is reflected back to the sensor probe. This reflected light is measured and used to infer percent oxygen saturation in the flap. The ViOptix probe attaches to a monitor which provides information on the flap's oxygenation or perfusion. Now, let's take a closer look at the different parts of the ViOptix system. A sensor probe is attached to a fiber optic cable leading to a sensor head. The sensor head then attaches to the ViOptix monitor via a connector channel. Each ViOptix monitor has two channels. Each of these channels can be used for a different flap, such as in cases of bilateral breast free flaps. The ViOptix monitor provides information on the flap oxygenation or perfusion. The signal quality value tells us whether or not the sensor probe is getting a good signal from the flap, telling us the reliability of the signal. Our goal for signal quality is greater than 80%. Things that can cause a poor signal quality are fluid between the probe and skin, poor contact of the probe to the skin, and bright lights. The tissue oxygen saturation. This measures oxygen locally in the flap and will provide a different number than the patient's pulse oximeter. The tissue oxygen saturation is also displayed on a graph showing trends over time. There is not an absolute value goal for oxygen saturation, but rather a trend over time. The ViOptix monitor typically comes mounted to a wheeled stand for mobility. Now, let's talk about setting up the ViOptix system in the OR. Before surgery starts, you'll want to be sure the ViOptix monitor and a sterile ViOptix probe sensor are in the OR. The AC power cord connects firmly to the rear of the console. Be sure to keep the ViOptix monitor plugged into an outlet as it has very limited battery life and cannot rely on batteries alone. The power switch should always be in the up position toward the 1. To turn the ViOptix monitor on, depress the on or standby power button on the right front of the console. The main screen will display after console boot up and self-tests have been performed. This can take around 60 seconds, so please be patient. The power on LED will flash slowly as the system is starting up. The surgeon applies the ViOptix sensor probe to a location on the flap where a good tissue oximetry monitoring location can be found. After the sensor probe is placed on the flap, the attached sensor head is passed off the sterile field. In order to connect the sensor head to the monitor channel, the nurse must first remove the dust cover from the monitor channel by rotating counterclockwise. The sensor head attached to the sensor probe connects to one of the two channels on the ViOptix monitor. Align the green arrows on the sensor head with the green arrows on the monitor channel. Do not push or force the sensor head. Instead, rotate the ring attachment on the sensor head clockwise until it snaps securely into place. Now that the ViOptix probe has been connected, tissue oximetry monitoring is begun by pressing the red square paused button on the monitor. This red box will change to a green arrow labeled sampling, indicating that the probe has begun monitoring. The surgeon may reposition the sensor probe until a signal quality greater than 80 is achieved. If the surgeon needs to reposition the probe, you may need to pause the monitoring by pressing the green arrow sampling button, and it will change back to the red square button. Once a good location for the sensor probe is found, a tegaderm is applied to the sensor probe to keep it securely in place. At the end of the case, the ViOptix monitor may be unplugged from the outlet briefly for transport, but do not disconnect the sensors from the monitor. The sensor heads are maintained connected at all times to provide continuous monitoring. After the patient has been transferred to the PACU or ICU, be sure to keep the ViOptix monitor plugged into an outlet, as it has very limited battery life and cannot rely on batteries alone. For further information, there is an official ViOptix in-service video available online at this website. Thank you for watching this presentation on the setup and use of ViOptix tissue oximetry monitor. Please stay tuned and follow for more videos on free flaps for OR staff.